Welcome to the American Hospital Association special podcast series, Just Lead, a look at how hospitals and health systems that have been recognized with AHA awards for innovation, collaboration, and health equity are transforming healthcare to better serve their communities. And you know what? They've been doing some remarkable things. Thanks for joining us. I'm Tom Hedderly with AHA Communications. Over the past few years, the concept of equity in healthcare has increasingly been moving from words in an online mission statement into real steps and concrete actions taken by healthcare providers all across the country. The American Hospital Association's annual Carolyn Boone Lewis Equity of Care Award was established to recognize and salute outstanding efforts among hospitals and care systems to advance equity of care. Today we'll hear from one of our 2022 honorees that set and achieved some specific equity goals. I'm pleased to welcome Ashleigh Hargrave, Senior Director of Diversity, Inclusion, and Equity at Novant Health in Winston-Salem, North Carolina. Well, let's get rolling then, Ashleigh. I guess I would begin by asking you this. Most health organizations are paying a lot of attention to their equity efforts right now and looking for ways to expand access to care for all patients. In fact, the American Hospital Association, you may be aware, last spring also released our own online toolkit called the Health Equity Roadmap as a resource to help all caregivers along the journey. So from Novant's point of view, why and when did your organization decide to commit to this path in terms of eliminating healthcare disparities?
So, Tom, I would say at Novant Health, we've always been committed to our patients. We're patient first. We believe that we're embedded in our communities, and we want to make sure that our patients know that they are the focus of what we do and why we do it. I would say that we've been on a journey throughout our health equity as well as our diversity and inclusion journey. And as part of that, just like any good road trip or a trip that you're taking, there are different stops along the way. And so as we begin to evolve and our community grew, we recognized that the strategies we had to embed also needed to reflect our community. And we wanted to understand, how did we make sure that we took that balanced approach to quality, patient engagement, team member engagement, as well as operational excellence? Because we know that all of those are a part of really what make a good patient experience when somebody encounters us and comes to one of our facilities.
There are many ways I think that an organization can pursue equity. There are many different paths you can travel to get there. But one of the most interesting one in Novant's case, I think, is the more equitable administration of the COVID-19 vaccine. So what was the problem there? What was your strategy? And what was the result?
Yeah, so I would say at Novant Health, one of the things that we started doing a few years ago is really segmenting our data by what we call real gaps. So that is race, ethnicity, language, gender, age, payer source, sexual orientation, gender identity. We've also started looking at zip code and then also social determinants of health. And so when we really begin to take that lens on how do we make sure that all of our communities are getting access to the COVID-19 vaccine, we realized that there were some glaring disparities. And so we had to take courage and really look at ourselves and say, where could we be doing a better job? What communities were being left out of the conversation when we looked at equity in terms of providing vaccines? And so when we began to really segment that data, we saw that two dimensions of diversity really came to the top: race and ethnicity, as well as our zip codes. And so we realized that depending on zip codes in certain areas of our communities where we may not have had a physical location, we recognized that we had to go out and really make sure that community members had access to vaccines. And so we really employed our team members, but also we looked at our community partners to say, who are trusted community partners within our, I'm going to use as an example, within our Hispanic or African American communities that we could partner with to talk about vaccine hesitancy, which was something we wanted to talk about, but also to make sure that people could get access to vaccines. And so once we did that, we wanted to hear from people. We didn't want to just go build something. We didn't want to go start a program. We wanted to hear from our patients and community members and our team members on what was needed. And so when that happened, we began to say, what can we do? How do we mobilize and make this happen? And so we did everything from mobile clinics where we took our mobile van and we were out in communities doing vaccines. We also utilized buildings that were already standing in communities with our community partners to be able to distribute vaccines. And one thing that I also want to point out is that we were able to also engage community volunteers who helped us in our COVID vaccine sites. And they were out there helping to get people checked in, helping to share information. And so it really became a community effort, not in us versus them. Also, I guess the impact after that is, how do we make sure that we're doing this as an always on? How do we make sure that we're looking at communities from an equity standpoint, utilizing those zip codes, utilizing real gaps to make sure that we're embedded in all areas of our community?
And then what were the results of all of that outreach and all of that effort? You saw some I guess, pretty encouraging numbers.
Yeah, we did. We always talk about, if you've ever worked in healthcare for any amount of time, you have a dashboard. And I always like to say, but what are those percentages beyond the dashboard? Percentages represent people. And so because we established a goal to really make sure that historically underrepresented communities received a proportionate distribution of the COVID-19 vaccine, we were able to set our goal at 25.3% to make sure that we were aligning with the demographics of historically underrepresented or underserved communities in North Carolina, and we surpassed that goal. We were able to achieve and exceed our goal with a rate of 31.6%, making sure that those vaccines aligned with the communities that we serve.
That's an impressive boost. Congratulations for that and seeing that kind of progress. Shifting gears just a little bit, Novant was also very active in something else called the Hope for Remarkable Team Aubergine, if I'm pronouncing that correctly, fund, which I think was an effort to help your caregivers kind of get their own act together so that they were able to work with the community and sort of supporting the caregivers so that they could in turn support others. Is that what that was about?
So it's so funny that you said about, our team members. So a lot of times when people come into a facility or hospital, they'll say, well, those are the people that work there and I'm the patient. But what we really realized with the Hope for Remarkable Fund was that our people are our patients, but our people also are on the front lines. And then they were having to turn around and come back and deal with their own family members and themselves, their own diagnosis at times. And so we recognize as an organization that we're only as strong as our people. So with our Hope for Remarkable Team Aubergine Fund, we were really able to support our team members with not only emotional support, which was huge during COVID-19, the height of the pandemic, but we also were able to make some tangible resources available for team members. We had over $13.9 million that we were able to distribute to our team members to help them meet needs in their families. So we recognized that there were team members who needed help paying bills. We had team members who needed, because of things that had gone on in their household, they needed help paying their rent and their mortgage, making sure that they had childcare. And so we recognized that if we were able to make sure that our team members were strong, they would also not just be able to be strong and come back to work, but they would have a better quality of life for themselves. And so from that program, we also have a program now called Thriving Together, which allows for programs that focus on human connection, financial and community resources, physical health, emotional health, leadership. And so we want to make sure that our team members have what they need and when they need it. And so we think that that's huge. Our team members, our people have to come first. And when they do, we all win, our organization and our communities.
That's a terrific story. I would think in addition to the appreciation for the economic help they've gotten, it must solidify the sense of family and sort of camaraderie among the work staff too. Just knowing that they sort of got each other's back, kind of a feeling. That's really something. If I could ask you about one more aspect of Novant's work, and some of the work that again came to the attention of the Carolyn Boone Lewis Equity Care Award judges, it would be this, and that's your work regarding the LGBTQ community and some of the things you did related to data collection. So if you don't mind describing that and how that contributed to greater health equity for the community and within your system.
Sure. So as we talked about earlier, really looking at our data, making sure that when we're looking at data, we're looking at data from an equitable perspective, we want to make sure that we're collecting demographic data on all of our patients. And so we recognize that sexual orientation and gender identity is a huge part of who a person is and how they show up for care, but also what specific care needs that our LGBTQ plus population may have. And so we really begin talking about how do we make sure we're providing the highest level of care to the LGBTQ plus population. Actually, in 2016, we said, how do we make sure we're collecting data and making sure that patients feel comfortable in sharing information with us? And so that process, before we launched it, we took a lot of time to understand dialogue, feedback. What would it look like in our health record system? What would education look like? What would the community want to make sure that we're explaining and talking about? How do we make sure we're using inclusive language? We recognize that the LGBT community is less likely to seek care at times because of many factors, the risk of being outed, feeling unsafe, having to educate their health team, and a fear of discrimination. And so really we wanted to make sure that we were able to increase trust. And so we created a Tell Us More campaign, which was really focused on why it's so important for the healthcare team to talk about sexual orientation and gender identity. We also were able to really rally with our Pride Business Resource Group, who really helped us to create an inclusive environment by providing all are welcome window clings, helping for education, helping to encourage clinicians to talk about pronouns with our badge reel clips that asked about pronouns. And then in April of last year, we even launched an enhanced physician finder tool, which allows patients to find providers who have an area of focus for LGBT plus care and trans care. And so we've heard phenomenal results from that because patients now have the ability to search for providers who have keywords like hormone replacement therapy or are able to do gender affirming surgery. And so because of that, we've been able to increase access to care for the LGBTQ community.
Well, I think we're just about wrapping up here at a time, but thank you again and congratulations again for remarkable and innovative progress on so many fronts at once. It sounds like it's making a terrific difference in your communities and for the patients you serve. And once again, congratulations for your as an honoree for the 2022 Carolyn Boone Lewis Equity of Care Award from the AHA. You have been listening to Ashleigh Hargrave, who is the Senior Director of Diversity, Inclusion, and Equity at Novant Health in Winston-Salem, North Carolina. Ashleigh, once again, thank you so much for your time.